When you've been diagnosed with cancer, your world is turned upside down. The diagnosis and treatment will change your body, energy, and probably your sexuality too. But can you have sex during cancer treatments? Hi, I'm Nienke Dekkinga, a Dutch sex educator specialized in cancer-related sexual challenges. In this video, I answer all your questions about if you can or cannot have sex during cancer treatment. Cancer and cancer treatments have an effect on your sexual needs and functioning. It could be that you have concerns and questions about sexuality and sexual functioning. It is very common for women who have treatment for cancer to have less desire for sex, an inability to have an orgasm, and or find that penetration during sexual activity has become painful. But remember, sex is a normal and important aspect of health and for your quality of life. So you should not hesitate to talk about your concerns and questions about the impact of cancer treatments on your sexual health to your practitioners. And if you don't know how to start this conversation, I've made a video for you to guide you through that conversation. But back to the topic of this video. Can you have sex during your treatment? There are a few factors that determine if sexual activity is safe during your treatment. In general, sexual activity is fine during treatment if you have sufficient sexual interest and energy. It's completely normal if you don't feel up to sexual intimacy after surgery or during radiation or chemotherapy. You can imagine if you had surgery or radiation therapy involving the pelvic area, for example, if you have had gynecological cancer, colon cancer, or anal cancer, you have to recover first before having sex that involves vaginal or rectal penetration, either with a penis, fingers, or toys. But fortunately, penetration sex is not the only sex you can have. So be creative if you like. And some treatments can cause open sores on your genitals or in your vagina. In that case, it is not recommended to have penetration sex. And if you have sores in the rectal area, rectal bleeding, or tears in the rectal tissue, I probably don't need to tell you that anal sex isn't a good idea. The same applies when you have open sores in your mouth. Don't have oral sex. But as I've a difficult one, but as I've said before, sex is more than just penetration. So if the sexual desire is there, go on discovery what is possible within your means. And if you have a low white blood cell count or low platelet count, you should be aware that vaginal, anal, or oral sex can cause problems. Sex is not forbidden, but knows that you have an increased risk of infection or bleeding when your counts are low. If in doubt, ask your doctor or nurse about it. Some other frequently asked questions around this topic are: can I have sex during chemotherapy? Well, to be honest, little is known about whether chemotherapy can be transferred to a sexual partner via saliva, semen, or vaginal fluid. So to be on the safe side, most doctors therefore recommend using a condom during the chemotherapy for up to a week afterward. This applies to vaginal, anal, and oral sex. For oral sex, you can also use a dental dam. It's a thin, flexible piece of latex that protects during direct mouth to genital contact. If you want to know what applies to you, it is best to ask your treating oncologist for advice. Because saliva can contain chemo too after treatment, French kissing might be tricky too during this time, as this can expose your partner to the chemo. Another question is, can I have sex during the period that I have radiation therapy? Yes, you can have any form of sex if you want. Penetration, oral sex, masturbation, anal sex, whatever you fancy. This doesn't affect the result of the radiation or other treatments. Of course, it is important that it doesn't hurt or cause bleeding. And is radiation therapy dangerous for my partner when having sex? No, not at all. You are not radioactive when you're being irradiated. After radiation, no radiation remains in the body, not even in sweat, urine, feces, or semen. With internal radiation, also called brachytherapy, radioactive material is placed in or near your tumor. Special safety measures are taken in connection with this type of treatment. After the difficult word again, radioactive material is removed from your body, there is no longer any radiation in your body. So you and your partner are completely safe to have sex. And another question is, can sex negatively affect my treatment? No, sex doesn't negatively affect your treatment or your chance of getting better. It's only important that when you have intercourse, it doesn't hurt or cause blood loss. Cancer can also not come back faster through sex. I hope I was able to answer all your questions. If not, feel free to drop a comment below and I'll be happy to answer. If you enjoyed this video, click on the like button and subscribe to my channel if you want to see more videos.